Why is psychometrics critical in the development and validation of psychological tests? Provide specific examples to support your argument. Answer. Psychometrics is a branch of psychology concerned with the theory and technique of psychological measurement, including the measurement of knowledge, abilities, attitudes, and personality traits. Its importance lies in its ability to provide a scientific foundation for developing, administering, and interpreting psychological tests. Key aspects: reliability. This refers to the consistency of a measure. A reliable test will yield the same results under consistent conditions. For example, if a test is administered multiple times to the same group, the scores should not vary significantly if the conditions remain the same. Validity. Validity refers to how well a test measures what it is supposed to measure. A valid test will accurately assess the intended construct, e.g., intelligence, anxiety. For instance, a math test should primarily evaluate mathematical skills and not reading comprehension. Norming. The process of establishing norms involves administering the test to a representative sample to create a benchmark for interpreting individual scores. For example, the IQ test norms allow for the comparison of an individual's score against the general population. Applications. Psychometrics is used in various fields, including educational testing, e.g., SAT, clinical psychology, e.g., personality assessments, and organizational psychology, e.g., employee selection tests. In summary, psychometrics ensures that psychological assessments are reliable, valid, and interpretable, which is crucial for effective decision-making in educational, clinical, and organizational contexts. Explain the fundamental differences between classical test theory (CET) and item response theory (ER). How do these differences impact the interpretation of test scores? Answer. Classical test theory (CTT) and item response theory (ERT) are both frameworks used to evaluate the properties of tests and assessments, but they operate under different assumptions and methodologies. Classical test theory (CTT) assumptions. CTT is based on the idea that each test taker has a true score, which can be derived from their observed score and measurement error. The observed score, x, is a combination of the true score, t, and error, e. Reliability. In CTT, reliability is estimated through statistics like Cronbach's alpha, which assesses the internal consistency of test items. A higher alpha indicates that the test items are measuring the same underlying construct limitations. CTT is limited by its reliance on aggregate data, meaning the results can only provide general information about groups rather than individual test takers. Additionally, item characteristics such as difficulty are not accounted for, leading to potential biases in interpreting scores. Item response theory assumptions. IRT focuses on the relationship between a test taker's latent trait, e.g., ability, and their probability of answering specific test items correctly. IRT models provide item parameters such as difficulty and discrimination. Item characteristics. IRT allows for the evaluation of individual items based on their properties. For example, an item with high discrimination will effectively differentiate between individuals of different ability levels. Flexibility. IRT is particularly beneficial for computer adaptive testing, where the difficulty of the test adjusts to the test taker's ability in real time, optimizing the measurement process. In summary, while CTT provides a general framework for understanding test scores, IRT offers a more nuanced analysis of individual item performance and can yield more precise assessments of ability. Emily, a clinical psychologist, is conducting an anxiety inventory using a new psychological test. During the testing process, Emily notices that the test results fluctuate when administered multiple times to the same individual, even though their anxiety levels haven't changed. Emily wonders whether the problem lies in the reliability or validity of the test. What should Emily focus on improving, and why? Answer. In Emily's situation, she is encountering measurement error in her anxiety inventory test. Measurement error can be categorized into random error and systematic error. Random error. This type of error occurs unpredictably and affects test scores due to variables such as the test taker's mood, environmental factors, or fatigue. Random errors can distort the reliability of test scores but may balance out over repeated testing. Systematic error. This occurs when there is a consistent bias affecting test scores. For instance, if the test is too difficult or too easy, it may consistently underestimate or overestimate the anxiety levels of all test takers. Emily should focus on improving reliability by examining the consistency of her test. Possible steps she could take include item review, analyzing the items on the test for clarity and relevance to ensure they accurately capture anxiety symptoms, standardization of testing conditions, implementing consistent conditions during test administration to minimize extraneous influences, G. Noise, time of day, increasing the number of items. More items may provide a more stable measure of anxiety, helping to reduce the impact of random errors. Explain the difference between interval and ratio scales of measurement and provide an example of when each type of scale is most appropriately used in psychological testing. Answer: the distinction between interval and ratio scales is crucial in psychological measurement as it influences the types of statistical analyses that can be appropriately performed. Interval scale characteristics: interval scales have ordered values with equal intervals between them but lack a true 0 point. For instance, temperature measured in Celsius has equal intervals. The difference between 10-dik and 20-dik is the same as between 20-dik and 30-dik, but 0-dik does not indicate the absence of temperature. Applications in psychology: interval scales are commonly used in psychological tests that involve attitudes or perceptions, such as Likert scales. For example, if a survey asks respondents to rate their anxiety on a scale from 1 to 5, the intervals between the ratings are equal, but there is no true 0. Ratio scale characteristics: ratio scales possess all the properties of an interval scale, but they also include a true 0 point, indicating the absence of the measured trait. An example is reaction time measured in seconds, where 0 seconds means no response. Applications in psychology: ratio scales are used in measurements such as reaction times, weight, and number of correct answers on a test. For instance, measuring how long it takes a participant to respond to a stimulus provides data that can be treated as ratio data, allowing for a full range of statistical analyses. In conclusion, correctly identifying whether a measurement is on an interval or ratio scale is crucial for selecting appropriate statistical methods, ensuring valid and interpretable results. Why is the selection of representative norm groups crucial in psychological testing, and what could be the consequences of using a non-representative sample? Answer: the use of representative norm groups is vital in psychological testing because it allows for valid comparisons between individual test scores and the scores of a larger population. Key considerations: generalization. Norms are derived from a sample that accurately reflects the diversity of the population for whom the test is intended. If a norm group is biased, e.g., overrepresenting one demographic, the test results may not accurately represent the broader population, leading to flawed conclusions. Consequences of non-representative samples: if a test is normed on a specific group, e.g., high-performing students in affluent areas, and then used to assess a more diverse population, the results could mislead educators or clinicians. Stratified sampling. To ensure representativeness, psychological tests should utilize stratified sampling techniques where subgroups, e.g., age, ethnicity, socioeconomic status, are proportionately represented in the sample. This enhances the generalizability of the test results. Compare and contrast the SAT and ASVAB in terms of their purpose, structure, and application in educational and vocational settings. Answer: the SAT, Scholastic Assessment Test, and the ASVAB, Armed Services Vocational Aptitude Battery, serve different purposes and target different populations, reflecting their unique design and application. SAT. Purpose: the SAT is primarily a college admissions test designed to assess a student's readiness for higher education. It evaluates critical reading, mathematics, and writing skills. Structure: the SAT consists of multiple-choice questions and an optional essay section. Scores range from 400 to 1600, with higher scores indicating a greater likelihood of academic success in college. Applications: SAT scores are used by colleges and universities to make admission decisions. They also play a role in scholarship opportunities, with many organizations using SAT scores as part of their selection criteria. SVAB. Purpose: the ASVAB assesses an individual's potential for success in military training and various career fields. It measures a range of abilities in areas such as math, science, and verbal skills. Structure: the ASVAB consists of multiple-choice questions divided into subtests covering topics like arithmetic, reasoning, word knowledge, and mechanical comprehension. Scores are reported as percentiles, indicating how well an individual performed compared to others who took the test. Applications: in addition to military enlistment, the ASVAB helps guide individuals toward suitable career paths by providing insights into their strengths and preferences. In summary, while the SAT is focused on predicting academic performance in college, the ASVAB is aimed at assessing readiness for military service and guiding career choices, reflecting their distinct purposes and target audiences. Discuss how the Wechsler Individual Achievement Test, WIAT, is used in diagnosing learning disabilities and the key domains it assesses. Answer: The Wechsler Individual Achievement Test (WIAT) is a comprehensive assessment tool used to evaluate an individual's academic skills across various domains. Components of the WIAT: reading. The reading section assesses skills such as word reading, reading comprehension, and oral reading fluency. For instance, a student may be asked to read a passage and answer questions about its content to evaluate their comprehension abilities. Mathematics. This section includes assessments of numerical operations, math problem solving, and mathematical fluency. A sample item might require the student to solve word problems or perform calculations. Written language. This domain evaluates skills in written expression, including spelling, sentence structure, and essay writing. For example, students may be asked to compose a short essay on a given topic to assess their ability to organize thoughts coherently. Oral language. This section focuses on listening comprehension and oral expression, measuring a student's ability to understand spoken language and articulate responses clearly. Importance of the WIAT: individualized assessment. The WIAT provides valuable information about a student's strengths and weaknesses in academic skills, allowing educators to tailor instruction to meet individual needs. Identifying learning disabilities. The WIAT is often used to identify learning disabilities and to determine eligibility for special education services. For example, a student who scores significantly below their peers in reading may be flagged for further evaluation. Monitoring progress. The WIAT can be administered periodically to track a student's academic progress over time, helping educators and parents understand the effectiveness of interventions or instructional strategies. In summary, the WIAT is a versatile tool that helps educators and psychologists evaluate academic skills comprehensively, aiding in the identification of learning needs and the development of effective instructional plans. Why is it important to correctly identify the scale of measurement used in psychological testing, and what are the implications for data analysis if the scale is misidentified? Answer: ethical guidelines in psychological testing are crucial to ensure that assessments are conducted fairly, responsibly, and with respect for the rights and dignity of test takers. Key ethical principles include informed consent. Test takers should be fully informed about the purpose, procedures, risks, and benefits of the assessment before agreeing to participate. For instance, if a test assesses sensitive topics such as mental health, individuals should be made aware of how the information will be used and the potential consequences of sharing their data. Confidentiality. Psychologists must protect the confidentiality of test results and personal information. This includes secure storage of test data and sharing results only with authorized individuals, such as the test taker or relevant professionals involved in their care. Cultural competence. Assessors should ensure that tests are culturally appropriate and sensitive to the backgrounds of test takers. For example, tests should not include language or scenarios that may be unfamiliar or biased towards specific cultural groups, which could lead to misinterpretation of results. Test fairness and accessibility. Psychologists should ensure that tests are fair and accessible to all individuals, providing accommodations as needed for those with disabilities. This may include offering alternative formats or additional time to complete the test. Competence. Test administrators must be adequately trained and qualified to administer, score, and interpret psychological assessments. This ensures that tests are used correctly and that interpretations are based on sound professional knowledge. By adhering to these ethical guidelines, psychologists can foster trust in the assessment process, promote accurate interpretations of results, and support the well-being of individuals undergoing testing. George is a high school senior considering his future career options. His school counselor administers the Differential Aptitude Test (DAT) to help guide his decisions. George excels in verbal reasoning but struggles with mechanical reasoning. Based on these results, what kind of career paths should the counselor suggest, and what further steps could be taken? Answer: psychological testing serves numerous practical applications across various domains, including clinical, educational, and organizational settings. 1. Clinical assessments, diagnosis of mental disorders. Psychological tests such as the MMPI Minnesota Multiphasic Personality Inventory can assist clinicians in diagnosing mental health conditions by comparing test results to established norms for specific disorders. Treatment planning. Assessment results can inform treatment decisions, enabling therapists to tailor interventions based on individual needs, such as cognitive behavioral therapy for anxiety disorders. 2. Educational contexts. Learning disabilities identification. Tests like the WIAT can identify students who may struggle academically due to learning disabilities, allowing for early intervention and support. Academic placement. Standardized tests. GSAT Act help determine students' readiness for advanced courses or college admissions, guiding educational pathways. 3. Organizational settings, employee selection. Psychological assessments such as personality tests can aid in selecting candidates for specific roles, ensuring a good fit for the organizational culture and job requirements. Performance evaluations. Regular assessments can help monitor employee performance and identify areas for development, leading to tailored training programs. 4. Research. Understanding human behavior. Psychological tests are used in research to study cognitive processes, personality traits, and behavior patterns, contributing to the broader understanding of psychology as a discipline. In conclusion, psychological testing is a valuable tool across various fields, providing insights that guide decision-making, enhance well-being, and improve educational and organizational outcomes. How do aptitude and achievement tests differ in their use for educational placement, and why might both types of tests be necessary? Answer. The development and validation of psychological tests is a systematic process involving several key steps to ensure that assessments are reliable and valid measures of the constructs they intend to assess. 1. Conceptualization. Define the construct or trait to be measured. This includes a thorough literature review and theoretical groundwork to establish clear objectives for the test. 2. Item generation. Create a pool of items that reflect the construct. Items should be varied in format. Multiple choice, true, false, and should cover different aspects of the trait. For example, when developing a personality test, items should encompass various dimensions of personality, such as extroversion and agreeableness. 3. Pilot testing. Administer the test to a small representative sample to identify any issues with items. Ambiguity or bias. Collect feedback to refine the items and improve clarity. 4. Item analysis. Conduct statistical analyses to evaluate the performance of each item, focusing on reliability. Internal consistency and validity. Criterion-related validity and item response theory may also be employed to assess item characteristics. 5. Norming. Establish norms by administering the test to large, diverse sample representative of the target population. This enables the development of comparative benchmarks for interpreting individual scores. 6. Validation. Validate the test through various methods, such as convergent and discriminant validity, to ensure it accurately measures the intended construct. For instance, a new depression scale should correlate well with established measures of depression while showing weak correlations with unrelated constructs. 7. Reliability testing. Reassess the test's reliability through methods such as test-to-test reliability, administering the test to the same participants after a time interval, and internal consistency measures. Cronbot's alpha. 8. Continuous review and revision. After the test is published, continuous monitoring and revision are necessary based on user feedback, advancements in the field, and ongoing research. This ensures the test remains relevant and accurate over time. In summary, the development and validation of psychological tests are iterative processes that require careful planning, analysis, and adjustment to ensure the resulting assessments are valid, reliable, and useful for their intended purposes. What is the fundamental difference between psychological assessment and psychological testing, and how does this distinction impact the interpretation of results in a clinical setting? Answer. Psychological testing refers to the use of standardized tests to measure specific aspects of an individual's mental functions and behaviors, such as cognitive abilities, personality traits, or emotional functioning. It focuses on obtaining scores or data points from well-established tools like the MMPI or WIOMVA. Psychological assessment, on the other hand, is a broader process that includes not just testing, but also integrating these test results with other forms of data, interviews, behavioral observations, background history, to provide a comprehensive understanding of the individual. In clinical settings, this distinction is critical. While testing provides quantifiable results, assessment requires the clinician to interpret these results in the context of the individual's life, symptoms, and environmental factors. Assessment often leads to more accurate diagnosis, treatment planning, and understanding of the individual's unique challenges. Testing alone, without assessment, may lead to oversimplified conclusions based solely on test scores. Relevant guidelines. APA Guidelines for Psychological Testing 2016 emphasized the importance of using a combination of testing and assessment for informed clinical decision-making. Alfred Binet is considered a pioneer in intelligence testing. Explain his major contributions and how his work laid the foundation for modern intelligence tests used today. Answer. Alfred Binet's most significant contribution to psychology was the development of the first practical intelligence test, known as the Binet-Simon scale, in 1905. He designed this test to identify children in the French school system who needed special educational assistance. Binet introduced the concept of mental age, which compares a child's performance to the average performance of children of a particular chronological age. His work shifted the focus of intelligence testing from measuring physical characteristics, such as phrenology, to evaluating cognitive abilities, such as memory, reasoning, and problem solving. Binet's approach has influenced many subsequent intelligence tests, including the Stanford-Binet Intelligence Scales, a revision by Lewis Terman, and the Wechsler Adult Intelligence Scale, WISE. His emphasis on cognitive skills and the importance of understanding individual differences in intelligence is foundational in modern psychological testing. Relevant guidelines. Ethical standards of intelligence testing emphasize using culturally sensitive and context-appropriate measures, building on Binet's initial framework of testing for practical purposes rather than innate ability measurement. Compare and contrast the trait theory of personality as proposed by Eysenck in the Big Five model with the psychoanalytic theories of Freud. How do these theories influence the approach to personality testing? Answer: the trait theory of personality, particularly Eysenck's theory, posits that personality is based on three broad dimensions: extroversion, neuroticism, and psychoticism. The Big Five model expands on this by identifying five major personality traits: openness, conscientiousness, extroversion, agreeableness, and neuroticism. These models assume that personality traits are relatively stable over time and can be quantitatively measured using tools like the NeoPIR or the Eysenck Personality Questionnaire. Freud's psychoanalytic theory, in contrast, views personality as shaped by unconscious processes and childhood experiences. Freud emphasized the roles of the ID, ego, and superego, along with defense mechanisms in influencing behavior. Testing in this domain is more qualitative, often involving projective tests like the Rorschach blot test or thematic perception test, TAT, where responses are interpreted based on underlying unconscious conflicts or desires. What trait theory leads to structured, objective personality assessments? Psychoanalytic theory leans towards more subjective, interpretive methods. The choice of theory impacts the type of test used and how results are interpreted. MS Anderson has been experiencing high levels of stress at work, leading to conflicts with her colleagues and difficulty concentrating. Her therapist suggests she undergo a personality assessment to better understand the underlying factors contributing to her behavior. The therapist is considering the use of the MMPI. Explain how the MMPI could be used in this situation and what aspects of MS Anderson's personality would be evaluated. Answer: the Minnesota Multiphasic Personality Inventory (MPI) is one of the most widely used objective personality tests designed to assess a range of psychological conditions and personality traits. In MS Anderson's case, the MMPI can be used to evaluate patterns of emotional distress, interpersonal difficulties, and cognitive functioning. It measures aspects such as anxiety, depression, social introversion, and hostility, which may be contributing to her work-related stress and conflicts with colleagues. The test would provide insight into specific personality traits or psychological conditions that might be exacerbating her stress response, allowing the therapist to tailor interventions that address these issues. For instance, if MS Anderson scores high on scales related to anxiety or depression, cognitive behavioral therapy (CBT) might be suggested to help her manage her emotional reactions and improve her workplace interactions. Relevant guidelines. AP8 guidelines for the use of the MMPI recommend that the MMPI be administered by trained professionals and that results be interpreted within the context of the individual's background and current situation, such as work-related stress. How did the use of psychological testing evolve during the World Wars, and what was the impact of this evolution on modern psychological testing practices? Answer: the World Wars significantly advanced the use of psychological testing. During World War I, the U.S. Army implemented large-scale psychological testing to classify and assign recruits. The Army Alpha and Beta tests were developed to assess verbal and nonverbal intelligence in literate and illiterate soldiers, respectively. These tests demonstrated the feasibility of using standardized psychological assessments on a mass scale, which was a novel concept at the time. World War I further expanded the use of testing, particularly in the area of personality assessment, as military organizations sought to screen for psychological fitness and the likelihood of success in specific roles. The development of aptitude tests for various military specialties, such as the General Classification Test, set the stage for similar uses in civilian settings. The impact of these wars on modern testing practices includes the widespread use of group testing, the refinement of psychometric techniques, and the expansion of testing beyond educational and clinical settings into industrial, organizational, and forensic contexts. Relevant guidelines. The standards for educational and psychological testing evolved from the need to ensure that tests are reliable and valid, lessons that were learned from the early military applications of psychological testing. What are the key differences between objective and projective personality tests, and in what situations might each be appropriately used in a forensic setting? Answer: objective personality tests, such as the MMPI or NeoPI, involve standardized questions with fixed response options, e.g., true, false, or Likert scales. These tests are highly structured, providing quantifiable data about specific personality traits. They are typically used in forensic settings when clear objective measures of personality are required, such as in custody evaluations or criminal responsibility assessments. Projective tests like the Rorschach ink blot test or TAT are more interpretive and involve open-ended responses. These tests are based on the premise that individuals will project their unconscious thoughts and feelings onto ambiguous stimuli. Projective tests are often used when deeper insight into an individual's unconscious processes is needed, such as in cases involving severe psychopathology or when malingering is suspected. In forensic settings, objective tests are preferred for their reliability and validity, but projective tests may be useful when assessing complex unconscious dynamics that might not be captured by objective measures alone. Explain how the NEO Personality Inventory NeoPIR assesses the Big Five personality traits and discuss its application in organizational settings. Answer: the NEO Personality Inventory NeoPIR is a widely used psychological assessment that evaluates the Big Five personality traits: openness, conscientiousness, extroversion, agreeableness, and neuroticism, often abbreviated as OCEAN. Each of these traits is further subdivided into 6 facets, providing a detailed profile of an individual's personality. Assessment methodology. The NeoPIR consists of 240 items, where respondents rate their agreement with statements on a 5-point Likert scale, strongly disagree to strongly agree. This format allows for nuanced responses that capture the complexity of human personality. The results yield a score for each of the 5 broad traits and their facets, offering insights into the individual's typical patterns of thoughts, feelings, and behaviors. Applications in organizational settings. Employee selection. Organizations often use the NeoPIR to assess job candidates' personality traits that align with specific roles. For example, high conscientiousness is typically desirable for roles requiring attention to detail and reliability, while high extroversion may be advantageous in sales or team-based positions. Team dynamics. Understanding the personality profiles of team members can enhance collaboration by ensuring that teams are composed of diverse traits that complement one another. For instance, combining high extroversion with high agreeableness can foster a positive team environment. Leadership development. The NeoPIR can identify potential leaders by evaluating traits like emotional stability, low neuroticism, and high openness to experience, both linked to effective leadership and employee development. The insights gained from the NeoPIR can inform personalized development plans, helping individuals leverage their strengths and address areas for improvement. Relevant guidelines. Standards for educational and psychological testing emphasize that personality assessments, including the NeoPIR, should be used ethically and in conjunction with other evaluation methods to ensure comprehensive insights into candidates' capabilities and potential fit within an organization. Discuss the challenges associated with scoring and interpreting personality assessments, particularly in clinical practice. How can these challenges impact the therapeutic process? Answer: scoring and interpreting personality assessments present several challenges that can significantly influence clinical practice and the therapeutic process. Complexity of interpretation. Many personality tests yield complex results that require skilled interpretation. For instance, raw scores must be contextualized within the individual's life experiences, cultural background, and current psychological state to derive meaningful insights. Clinicians must be trained to understand the nuances of personality dimensions and how they manifest in different individuals, avoiding overgeneralization or misinterpretation. Test validity and reliability. The validity, accuracy in measuring what it intends to measure, and reliability, consistency of results over time of tests can vary. Clinicians need to be aware of these factors and select tests with robust psychometric properties If a test is not valid for a specific population or context, the results may lead to inappropriate conclusions or treatment plans. Cultural and contextual considerations. Personality assessments can be influenced by cultural norms and values. A trait considered positive in one culture may not be viewed the same way in another. Clinicians must be culturally competent and sensitive to these variations, ensuring that they interpret results with an understanding of cultural influences. Impact on therapeutic process. Misinterpretation of assessment results can lead to incorrect diagnoses, ineffective treatment strategies, or a lack of trust in the therapeutic alliance. Clients may feel misunderstood if their results are not accurately represented or if they receive stigmatizing labels. Conversely, accurate interpretation can enhance the therapeutic relationship, providing a clearer understanding of the client's challenges and fostering a collaborative treatment approach. What are some common applications of personality testing in clinical settings, and how can these applications enhance the effectiveness of psychological treatment? Answer: personality testing is widely utilized in clinical settings for various applications that enhance the overall effectiveness of psychological treatment. Diagnostic tool. Personality assessments can aid in diagnosing personality disorders and other psychological conditions. For instance, the MMPI can reveal patterns indicative of specific disorders, guiding clinicians in their diagnostic process. Treatment planning. By understanding a client's personality traits, therapists can develop tailored treatment plans. For example, a client high in neuroticism may benefit from techniques focused on emotional regulation, while someone high in openness may thrive in exploratory therapies. Monitoring progress. Repeated assessments can track changes in personality traits and emotional functioning throughout treatment. This feedback can motivate clients by highlighting their progress and adjusting therapeutic interventions as needed. Enhancing therapeutic alliance. Insights gained from personality assessments can help clinicians adapt their communication and therapeutic styles to fit the client's preferences. This personalized approach fosters a stronger therapeutic alliance, enhancing the effectiveness of treatment. Crisis intervention. In situations of acute distress, understanding a client's personality can inform immediate interventions, helping clinicians identify coping mechanisms or vulnerabilities that need addressing. Relevant guidelines. Standards for educational and psychological testing advocate for the ethical use of personality assessments, emphasizing the importance of validated tools and the integration of test results with clinical judgment to inform treatment decisions effectively. How does psychological testing influence educational decision-making, and what ethical considerations should be taken into account when using these tests? Answer: psychological testing plays a crucial role in educational decision-making by providing data that informs various aspects of student assessment and support. Identification of learning needs. Psychological tests are used to identify students with learning disabilities, giftedness, or other educational needs. Tests can reveal specific cognitive strengths and weaknesses, guiding appropriate interventions and support services. Placement decisions. Results from psychological assessments inform decisions about special education placements, advanced programs, or interventions tailored to individual learning profiles. Accurate assessments ensure that students receive the necessary support to succeed academically. Program evaluation. Schools often use psychological testing to evaluate the effectiveness of educational programs and interventions. Data from assessments can indicate whether students are making progress and help schools adjust curricula or teaching strategies accordingly. Personalized learning plans. Psychological testing contributes to the development of individualized education programs (EAPS) that address the unique needs of students. This personalization enhances student engagement and success. Ethical considerations. Fairness and equity. Ensuring that tests are culturally fair and valid for the populations being assessed is essential. Tests should not disadvantage any group based on cultural or socioeconomic factors. Informed consent. Students and parents must be informed about the purpose of testing, how results will be used, and their rights regarding confidentiality. Confidentiality. Protecting the privacy of test results is crucial, as misuse can lead to stigmatization or discrimination. Professional oversight. Only trained professionals should administer and interpret psychological tests to ensure ethical practices and appropriate use of test results. Relevant guidelines. APAS guidelines for the use of psychological assessments in education stress the need for fairness, respect for individual rights, and the integration of multiple sources of information when making educational decisions based on psychological testing results. When defining the construct and objectives for a psychological test, what are the key considerations to ensure the construct is both valid and reliable? Discuss how construct validity and criterion validity play a role in this process. Answer: defining the construct and objectives for a psychological test is a critical step in the test development process. The key considerations include clear definition of construct. The construct should be defined in precise and clear terms. For instance, if the test measures anxiety, it must specify which aspects of anxiety are being evaluated, e.g., physiological symptoms, cognitive aspects, or behavioral tendencies. The definition should be grounded in theoretical frameworks and supported by empirical research. Alignment with objectives. The test objectives should align with the construct definition. If the goal is to measure anxiety levels, the objectives might include assessing different anxiety dimensions, such as state versus trait anxiety, or the impact of anxiety on daily functioning. Validity considerations. Construct validity. This type of validity assesses whether the test measures the intended construct. It can be subdivided into two primary types. Convergent validity tests whether the measure correlates with other measures that assess the same or similar constructs. For example, a new anxiety test should show high correlation with established measures of anxiety. Discriminant validity ensures that the measure does not correlate strongly with measures of unrelated constructs. For example, an anxiety test should not correlate strongly with measures of intelligence. Criterion validity. This involves evaluating how well one measure predicts an outcome based on another measure. It can be predictive validity, the extent to which the test predicts future outcomes. For example, a test of academic anxiety should correlate with students' performance in high-pressure academic situations. Concurrent validity, the extent to which the test correlates with a measure taken at the same time. For instance, a new depression scale should correlate with a well-established depression scale. Reliability. In addition to validity, reliability is essential. A test should yield consistent results across time and different populations. Techniques such as test-to-test reliability, inter-rater reliability, and internal consistency, e.g., Cronbot's alpha, should be assessed during the test development process. Explain the purpose of the difficulty index in item analysis. What range of difficulty index values is typically considered ideal in high-stakes testing, and why? Answer: the difficulty index, also known as the p-value, is a crucial metric in item analysis that indicates the proportion of test takers who answer the specific item correctly. This index provides insights into the performance of individual test items, helping educators and psychologists to evaluate the quality and effectiveness of the items in measuring the intended constructs. Purpose of the difficulty index. Assessment quality. The difficulty index helps assess whether test items are appropriately challenging. If most test takers answer an item correctly, it may be too easy, while if very few answer it correctly, it might be too difficult or poorly worded. Differentiation. A well-constructed test should differentiate between high and low-performing students. The difficulty index can indicate how well a test item performs in this respect. Test adjustments. The difficulty index informs test developers about which items may need revision, deletion, or replacement to improve the overall quality of the test. This can lead to adjustments that enhance both validity and reliability. Ideal range of difficulty index values. In high-stakes testing, an ideal difficulty index typically falls within the range of 0.30 to 0.70. Values between 0.30 and 0.70. Items within this range are considered optimal because they are neither too easy nor too difficult, allowing for effective discrimination among test takers. Items in this range encourage a spread of scores that reflect a range of knowledge or ability. Values below 0.30. Items with difficulty indices below 0.30 may be too difficult. They can lead to a ceiling effect where high-achieving test takers are unable to demonstrate their knowledge effectively, potentially skewing the results. Values above 0.70. Items with difficulty indices above 0.70 are often too easy. These items may not provide meaningful differentiation between test takers, thus limiting the assessment's effectiveness in distinguishing between varying levels of proficiency. By adhering to the ideal range, test developers can create more reliable and valid assessments that accurately reflect test taker knowledge and abilities. What are the advantages and limitations of using Likert type items in psychological assessments? How does response bias affect the interpretation of Likert type items? Answer: Likert type items are a common format used in psychological assessments to measure attitudes, beliefs, or opinions. They typically provide a statement followed by a scale of response options, e.g., strongly agree, agree, neutral, disagree, strongly disagree. Advantages of Likert type items. Ease of administration. Likert scales are straightforward to administer and understand, allowing for efficient data collection. Versatility. They can be adapted to measure various constructs, including emotions, beliefs, and behaviors, making them highly versatile in psychological research and practice. Richness of data. By providing a range of response options, Likert type items capture nuances in attitudes and opinions, facilitating more detailed analysis compared to binary yes-no responses. Quantitative analysis. The ordinal nature of Likert type items allows for statistical analyses that can yield valuable insights into patterns and relationships within the data. Limitations of Likert type items. Assumption of equal intervals. Likert scales assume equal intervals between response options, which may not truly represent the subjective distance between them. For example, the difference between agree and strongly agree may not be perceived as equal to the difference between neutral and agree. At limited depth of understanding, while Likert type items provide a quantitative measure, they may not capture the complexity of respondents' feelings or reasoning behind their choices. Impact of response bias. Response biases can significantly affect the interpretation of Likert type items, leading to distorted findings. For example, if a substantial number of respondents exhibit central tendency bias, the results may fail to reflect the true variability in attitudes, leading to misinterpretations of the data. Acquiescence bias can inflate scores, giving an inaccurate picture of general attitudes. If many participants tend to agree with items without considering their content, it may lead to overgeneralized conclusions about a population's attitudes. What are the key characteristics of performance-based assessments, and how do they differ from traditional test formats like multiple-choice questions? Answer: performance-based assessments are designed to evaluate a test taker's ability to apply knowledge and skills in real-world or simulated scenarios. Unlike traditional formats, such as multiple-choice questions (MES), which often measure factual recall, performance-based assessments require participants to demonstrate their competencies through active engagement in tasks. Key characteristics of performance-based assessments. Real-world application. These assessments simulate real-life situations where individuals must apply their knowledge and skills, making them more relevant to practical contexts. Open-ended format. Performance-based assessments often utilize open-ended tasks that require detailed responses, such as essays, presentations, or project-based evaluations. This format allows for creativity and deeper exploration of the subject matter. Higher cognitive demand. These assessments typically demand higher-order thinking skills, such as analysis, synthesis, and evaluation, rather than simple recall. For example, a student might need to analyze case studies to develop appropriate intervention strategies. Differences from traditional test formats. Nature of measurement. Performance-based assessments measure application and synthesis of knowledge, while traditional formats like MCQS often assess rote memorization and basic understanding. Response format. NMCS. Respondents select an answer from provided options, which can limit the demonstration of knowledge application. In contrast, performance-based assessments involve creating or demonstrating responses, allowing for a richer display of understanding. Scoring complexity. Scoring performance-based assessments can be more complex and subjective compared to SES, which are straightforward to score. Evaluators often use rubrics to assess multiple aspects of performance, which requires clear criteria to ensure consistency and objectivity. Feedback opportunities. Performance-based assessments often provide opportunities for formative feedback, allowing learners to reflect on their performance and improve. Traditional assessments, particularly those that are summative, may not provide the same depth of feedback. Identify 3 major neuropsychological tests and explain how each assesses specific cognitive domains. Discuss the implications of the results from these tests in clinical settings. Answer: neuropsychological tests are essential tools for assessing cognitive functioning and diagnosing potential neurological or psychological conditions. Here are 3 major neuropsychological tests and their implications. Wechsler memory CWME, cognitive domains assessed. Memory functioning, including short-term and long-term memory, verbal memory, and visual memory. Test structure. The WMS includes subtype memory, assessing verbal memory through story recall and visual reproduction, evaluating visual memory through the reproduction of designs. Clinical implications. Results from the WMS can identify specific memory deficits that may be associated with conditions such as dementia, traumatic brain injury (TBI), or learning disabilities. Clinicians can use the findings to tailor rehabilitation strategies, educate patients and families about memory issues, and track changes in memory over time. Wisconsin card sorting tabulacy. Cognitive domains assessed. Executive functions, particularly cognitive flexibility, problem solving, and set shifting abilities. Test structure. The WCST requires participants to sort cards based on different criteria, color, shape, number, without being explicitly told the sorting rules. The ability to shift strategies based on feedback is evaluated. Clinical implications. Poor performance on the WCST may indicate executive function deficits commonly seen in conditions such as schizophrenia, frontal lobe damage, or neurodegenerative disorders. Understanding these deficits can guide interventions aimed at improving cognitive flexibility and adaptive functioning in daily life. Bender Visual Motor Gestalt Test. Cognitive domains assessed. Visual motor integration, visual perception, and motor coordination. Test structure. Participants are asked to reproduce a series of geometric designs. The accuracy of their drawings is evaluated to assess visual motor functioning. Clinical implications. Results can reveal developmental delays, learning disabilities, or neurological impairments. Clinicians often use the Bender test to assess children and adults in educational or clinical settings. The findings can guide recommendations for accommodations or interventions that target visual motor skills. Mrs. Garcia, a 62-year-old woman, presents with concerns about memory loss and difficulty focusing. Her family reports that she has been forgetting daily tasks and struggling to organize activities. You have been asked to conduct a neuropsychological assessment based on the purpose of neuropsychological testing. Which tests should you administer and what cognitive domains should you assess? How would these tests help in diagnosing cognitive deficits? Answer. In Mrs. Garcia's case, a neuropsychological assessment should include tests that assess memory, executive function, attention, and visual spatial abilities, as these cognitive domains are commonly affected in cases of memory loss and difficulties with focus and organization. Wechsler memory (CWME) can be used to assess different types of memory functions, including immediate recall and delayed recall, to pinpoint areas of memory deficits. Wisconsin card sorting tableau is essential for evaluating executive function, particularly her ability to shift strategies and think flexibly, which may explain her organizational difficulties. Bender Visual Motor Gestalt Test would be useful to assess visual spatial abilities, which could be contributing to her challenges with daily tasks. These assessments, when interpreted collectively, would provide a comprehensive understanding of Mrs. Garcia's cognitive deficits and help in diagnosing possible conditions such as mild cognitive impairment, MSI, or early-stage dementia. What are the major considerations when writing and selecting test items for a psychological assessment? Explain how content validity is ensured during the item selection phase. Answer. When writing and selecting test items, it is important to consider clarity, relevance to the construct, and the format of the questions. Each item should be designed to measure specific aspects of the construct and should be free from bias or ambiguity. To ensure content validity, test developers need to make sure that the items adequately cover all aspects of the construct being measured. This can be achieved by involving subject matter experts, SMEs, to review the test items and ensure they represent the full breadth of the construct, using blueprints or test specifications that outline which domains or subdomains should be included. Additionally, items should be piloted and revised based on feedback to improve their ability to measure the construct effectively and without bias. What are the key challenges in translating psychological assessments for cross-cultural testing? How can test developers ensure that the test remains valid and reliable across different cultures? Answer. The key challenges in translating psychological assessments for cross-cultural testing include language differences, cultural biases, and contextual relevance. Direct translations often do not capture the same meaning or cultural nuance, which can affect the test's validity. To ensure that the test remains valid and reliable across cultures, developers should conduct back translation, where the test is translated into the target language and then translated back into the original language by an independent translator. Use cultural adaptation strategies to modify items that may not be relevant or understood in the same way across different cultures. Conduct cross-cultural validation studies to ensure that the translated version measures the same construct equivalently. Dr. Roberts is designing a multiple-choice test to assess clinical reasoning skills in psychology students. He is considering using distractors that are either obviously wrong or subtly incorrect. What are the best practices for writing effective distractors, and how should Dr. Roberts ensure that his MCQs are assessing higher-order thinking rather than simple recall? Answer. Best practices for writing effective distractors include ensuring distractors are plausible and reflect common misconceptions or errors related to the content, avoiding trick questions or distractors that are obviously wrong as they fail to challenge higher-order thinking. including subtly incorrect distractors that require students to apply critical thinking and reasoning to identify the correct answer. To assess higher order thinking, Dr. Roberts should focus on crafting questions that require students to apply, analyze, or evaluate information rather than simply recalling facts. He can achieve this by embedding scenarios or case studies into his questions that require students to integrate multiple concepts and apply them to solve a problem. Dr. Smith is a psychologist administering a cognitive ability test to a group of high school students from diverse cultural backgrounds. After analyzing the test results, she notices that students from one particular cultural group consistently score lower than their peers. What steps should Dr. Smith take to ensure that the test is fair and valid for all students? Discuss the ethical considerations involved in her assessment process. Answer: Dr. Smith should take several steps to ensure the fairness and validity of the cognitive ability test for all students, particularly those from diverse cultural backgrounds. Here are key actions she should consider. Review for cultural bias. Action: Dr. Smith should examine the test items for cultural relevance and potential bias. This involves assessing whether any items may be grounded in cultural references, idioms, or knowledge that might disadvantage students from certain backgrounds. Analyze language proficiency. Action: Dr. Smith should evaluate the language used in the test and the language proficiency of the students. If students are not native speakers of the test language, she may consider providing tests in their primary language or using language simplification techniques. Consider the use of culturally relevant norms. Action: Dr. Smith should investigate whether the norms used to interpret test scores are appropriate for the cultural groups represented in her sample. If necessary, she could consider developing separate norms based on the cultural backgrounds of her test takers. Implement a multimodal assessment approach. Action: Dr. Smith might include other assessment methods, such as interviews, observations, and alternative assessment formats, to obtain a holistic understanding of each student's abilities. Engage in ethical practices. Action: Dr. Smith should adhere to ethical guidelines, such as those outlined by the American Psychological Association, APA, which stress the importance of fairness, integrity, and cultural sensitivity in testing. Continuous evaluation and feedback. Action: After implementing changes, Dr. Smith should continuously evaluate the outcomes and seek feedback from students and other educators regarding the assessment process. By taking these steps, Dr. Smith can enhance the validity and fairness of her cognitive ability test, ensuring that it serves as an accurate reflection of the students' abilities, regardless of their cultural background.